So I'm Dr. Asha Patel. I'm a clinical psychologist and the founder of Innovating Minds. Innovating Minds exists because I worked in forensic mental health services and medium secure services with adults that completed really serious offending behaviour who got really complex mental health difficulties. Their difficulties started off in early childhood and they couldn't access the help and support that they needed. Now, the takeaways that I wanted to bring up today from the session that we've read, and I'm just going to read out this first. The number of children with educational health and care plans with social, emotional and mental health needs, that includes they've got ADHD, has gone from 28,000 to 71,000. Now, the reason why I'm bringing this up is because actually it's really important to take into consideration the mental health needs of the children that we're supporting in SEND. Now, often, and I can hear the frustration around health, and working with health is quite difficult. I can say that because I'm one of those, and I fit in that category. But it's really frustrating because often what we hear from schools, from parents, from children is actually we have this oscillation taking place. Well, it's the ADHD, it's the autism, it's not the anxiety, and therefore they get moved from pillar to post and not being able to access the help and support that they desperately need. So we've got to find a way, because this is a really great opportunity, how do we bring health on board? Yes, we might go through reforms, but the systems that we can use within education to actually bring clinicians into this. As a clinician that was trained in that field, we don't work well with education because the system is so different to what we're used to in health, and therefore our way of working doesn't translate into education. That doesn't mean we shouldn't be there, or we shouldn't just be flying into meetings or coming in and doing an assessment and leaving. Secondly, the impact of trauma. We know the significant amount of evidence around ACEs, adversity. We also know that children and families are experiencing more trauma and adversity than previously. So when we're in a position of assessments, diagnosis, looking at reviews, we also need to take into consideration the impact of trauma. The evidence base clearly shows us there's an overlap, there can be an overlap between symptoms that manifest that look like maybe ADHD, autism, but actually they're trauma reactions that are taking place and presenting. And we are now then taking families down the route of diagnosis to be able to access support. That's not really good enough. We should be building and using upon the evidence base around neuroscience and relational-based approaches. A lot of the work, the good work that takes place is because of the relationships that your frontline practitioners have with the students and